I'm here today to have some surgery done, and I'm ready to go.
We are going to be doing the surgery for Bernie, and we're going to do a superficial parotidectomy. So the surgery is actually a pretty interesting one because we are able to do all of it through a small incision. The first team, which is me and an assistant, we're going to remove the tumor first from the parotid gland after identifying the facial nerve and all its branches and protecting them. Then Dr. Azizadeh is going to come in and reconstruct the area so that the two sides look exactly the same at the end of the surgery.
We have very advanced reconstructive techniques so that the patient does not look like they've ever had surgery.
Due to the fact that we do these surgeries on such a regular basis, we've turned this into a completely an outpatient procedure.
I'm in good hands.
If you're going to have that experience, Dr. Larian's the one to do it with. The people around me that did it was fantastic. I couldn't ask for more. Just a little tightness and that's it. It's like I have a new face.
Bernie's final pathology came back, and unfortunately it was a cancer. So the treatment he needed was the surgery with the addition of radiation therapy to it.
All right, Bernie, how are you feeling?
I feel great.
Are you having any pain or discomfort in your face?
A little, like that numbness from the nerves you said. It'd take a while to build back up.
Okay.
But other than that, no difference. Nothing,
Okay.
really.
Do you have any weakness in the muscles of your face at all?
No.
No? Your eyes closing perfectly well?
Mm-hmm.
Okay. Any trouble with eating or swallowing or anything like that?
No.
I'll look around and show the scar area, which is healed well, and then in the back there.